Taping for shoulder subluxations. Now, there's a lot of different things that can happen, whether it's hypermobility, maybe it's a stroke, but addressing the shoulder and preventing further risk of dislocation is really, really important. So when we think about the shoulder, especially when we're doing taping techniques, we want to consider the deltoid and the rotator cuff, and they both act like a suction cup, keeping that joint in the socket. So in his case, what we're going to do is I'm going to make sure the shoulder blade is set where I need to be, so slightly back. I'm going to tear off a little front piece of the tape, lay that first inch on, and I'm going to cover the front part of the chest. And the first part is I'm going to wrap that shoulder back. So by applying it in this direction, so if he slightly turns to the side, it's keeping that joint into the shoulder, okay? So on this one, I'm going to peel most of it off. This is about 100% stretch. I'm going to do about 75%. So what I'm going to do is I'm going to just wrap it around, make sure I get around the head. As we go to the back side, if you can just go ahead and turn again, you can see where it ends up on the back side. So that's going to be our stopping point. So as he turns back forward, we're going to do the same thing, just rip off the very end. We're going to lay it down right in the same spot. Make sure you rub it in. And now I want to make sure that the shoulder blade is set back. The thing is, when that shoulder blade is set too far forward, it allows that head of the humerus to translate more forward, therefore increasing the risk of a subluxation. So now that I've gotten the humerus compressed, now I'm going to set everything back. So now what I'm going to do is, getting this here, I'm going to stretch it about 75%. This is 100, about 75%. So I'll have him turn as we do this so you can see what it is I'm doing. I'm going to lay it, so as you turn that way, all the way around. So I'm going to end up bringing it at an angle toward the back. That way this shoulder blade sits back. So now when you look at the front, as he turns back forward, you can see that humerus is in and the shoulder blade is set back for optimal position of that humeral head of the shoulder. So this is a great taping technique that it's not super restrictive, but it's a good way to start giving information into these muscles to contract. That way it helps keep the joint into the socket.